would please. Governor Beshear claims the GOP budget cuts Medicaid by $2.7 billion and will lead to reduced services in Kentucky. This could lead to higher insurance rates and Kentuckians going without health care. How might you fight for Kentuckians if elected to the House?
With regards to healthcare, the rapidly rising cost of healthcare affects every family in Kentucky. It's an unfortunate reality that there are families in our communities that have had to give up their coverage because they simply can't afford their premiums anymore, or who can't fill prescriptions that they need because they can't afford them. When I think about healthcare, I see short-term problems and long-term problems. The major short-term problem that I see is the underfunding of Medicaid in our state. The new budget that was just passed by our legislators in Frankfort has underfunded Medicaid by $691 million. The reality is that this puts rural hospitals that depend on Medicaid for reimbursement at risk of closure. Rural communities will bear the brunt of these cuts. These cuts affect families and children as well. In 2024, around 40% of the births in Kentucky were covered by Medicaid. In terms of longer-term issues with healthcare, we need our legislators to regulate the health insurance industry so that citizens receive better coverage in exchange for our premiums. Some examples include establishing state-level boards to review drug prices and to cap consumer costs on prescription drugs, like insulin. Lawmakers can also mandate that hospitals and insurers disclose their negotiated rates so that consumers can make informed choices about affordable care.
Rory, same question to you.
How many of you have medical insurance? Raise your hands.
I would.
Okay. How much is that medical insurance part of your budget? A third? A third?
About 25%.
About 25%. Okay. So what's going on is a defunding to destroy. Okay. And have you noticed that our local hospital has changed its name to Centerpoint? One has to wonder why it's changed its name. Maybe it was bought out. Okay? Understand the very wealthy like to go shopping for bargains, just like you like to go shopping for bargains. And when they defund our hospitals, they can buy those hospitals at pennies of the dollar. Okay? So, later on, they have monopoly power. So, when they decide to fund those hospitals, you're going to be paying more and more because they have monopoly power. And understand, rural hospitals are a monopoly. And when you defund a public hospital and replace it with a private hospital, that is giving a very wealthy person a bonus at the expense of your health. Okay? So this is a short-term gain to create long-term pain. That is what Republicans are doing to you.
Tom.
Time.
Thank you, Roy.